Are you ready to be connected? You're listening to the Insured Connection podcast by Pica Group, a pro assurance company, where we provide expert advice for your practice when you need it most. We connect you with industry leaders to discuss timely topics so you can listen, learn, and get back to caring for your patients. Now, let's connect.
Well, hello, everyone. This is your host, Dr. Adrianne Ross. Again, thank you for joining the Insured Connection. As we're here and bringing a little bit again behind the scenes and some of the words of wisdom from our attorneys, from the deans of our medical colleges, as well as from some of our insureds. We really try to give you a little bit more of the behind the scenes within PICA. And so today I am very excited to have Dr. Allan Boike, Dean of Kent State University Podiatric Medical School, and also our very own Dr. Luke Cicchinelli. So thank you, Dr. Boike.
Thank you. Thank you for having me here.
Allan, thanks for making yourself available. We're thrilled to have you.
My pleasure.
So, Dr. Boike, I was just going to, you've had a lot of experience, obviously, within education. You've been the dean now for almost 10 years, correct?
Yeah, actually, a little over, so almost 11.
Wonderful. And you're obviously very passionate about student recruitment and, what's going on in our medical schools. And so can you peel back kind of what those last 10 years has culminated and why are you so passionate about, kind of the education side of it?
Well, I've always enjoyed the education side of it from the time I actually graduated from podiatry school. I've been involved in resident training, actually practiced for about 3 years and then went back to what was then the Ohio College of Podiatric Medicine and taught in the surgery department for about 9 or 10 years at that time. I then left, went into private practice for a short period of time, and then went to the Cleveland Clinic where we started a residency program and trained residents and students, mostly from Kent State at that time, or college. About 10 years ago, there was an opportunity at Kent State, and it seemed to fit something I was very passionate about and wanted to have an effect on podiatric medical education. And I was fortunate enough to get the position. So that's a little bit of a background on where it all started. I then tried to come to the college and maybe effect some changes, make things a little bit better for the students. And I've tried to be a student advocate since I got to the college.
So it's interesting. A lot of students rotate through, and so I get a chance to meet a lot of them, and that's the resounding tone is that you're always their advocate. So it's really, I mean, if you're setting out to be that, it seems like that's definitely ringing true.
Oh, that's good to hear. Well, at least one mission accomplished.
Hey, Allan, with all your varied background, because you've always been an educational leader and proponent and so forth, what's the biggest change you've seen within the integration or acceptance of the podiatric medical students in the broader hospital, multi-specialty type environment? Have you seen since your Cleveland Clinic days to your dean days and then all the rotations that I'm sure the students are at? What's your sort of pulse? What's your finger on that pulse?
I think that, it's improved so much especially since I was a student, and the difference in the acceptance and, what the expectations are from a student when they rotate, I think has just increased immensely from the standpoint of it used to be when you went on a rotation, it was like you were the podiatry student, you're kind of on the side. I think now there's a lot of full integration of the podiatry student, the podiatry resident into the medical rotation that they're doing. And to me, that's been a major improvement in our education process.
Do you hear the same, Adrian, when you're having probably students rotating through Emory and the places you're affiliated with?
I do. And I hear also from the other side, from our non-podiatric colleagues that have just a lot of respect, for how the students are coming through. So it's encouraging to see.
I think the surprise is sometimes we will actually get letters or a call from, an MD attending somewhere saying, hey, your student was the best student we've had rotate through here. I'm talking about medical students, and podiatry students. So, that's a really fulfilling thing to hear that.
That's wonderful.
Yeah, I agree. So I have a quick question. I mean, obviously you graduated from the Ohio school and now you're the dean of the school. So what is unique about the school? So if I had medical students or, college students that were interested, that's a question that comes up quite a
Yeah.
bit,
I think the uniqueness of Kent State, and it varies because all the colleges of podiatric medicine have a lot of positive things that go on. But one of the things that I like about our college at this point in time is the fact that for the first 2 years, our faculty we have dedicated what we call preclinical or basic science faculty who are at our college, and they're dedicated to our students. They're not. They don't have attention toward multiple other specialties or they're not teaching the DO students or the MD students or the PA students.
I
They're
see.
pretty much dedicated to our students and they're available to them. They're on our campus. So I think that's a real perk that we have from that standpoint. And we can control that curriculum. Our preclinical faculty are the ones who control that curriculum.
Yeah. Uh, I've noticed that the students that I've seen rotate through, there's quite a few of them, that they also seem very, very, very well rounded. So they're asking me questions about the practice of medicine, billing and coding, research. Not just surgery, which is encouraging.
Yeah, I think one of the things we try to do is tell the students and let the students know surgery is an integral portion of what we do, but there are so many other things to the practice of medicine that they need to be familiar with in order to be successful. So I'm sure other colleges do the same thing, but we want to make sure that they understand that they have a holistic approach to treating patients.
Mhm. Yeah, I
It
definitely.
makes me think of something as well. When I'm out there on the trail talking to students, other folks, I frequently over the last few years I've started adding in around the spirit of being perpetual learners about don't not being afraid to continue even maybe a parallel degree because for me our healthcare system delivery model is a huge sort of enigma wrapped in a riddle about you know I don't know sustainability, how it works, how it doesn't work, and so forth. So my question is, does Kent State offer or do you encourage students to, hey, listen, maybe do an MBA or a master's in uh, policy administration or hospital administration or some parallel path? I believe in parallel passions. And
Yeah.
I believe parallel passions professionally could be really advantageous for our current students.
We do, Luke, and actually Kent State has a College of Public Health. So we have a
Perfect.
dual degree with our College of Public Health. They also have business schools, so we offer an MBA. And those degrees are kind of mixed in. So some of the students will actually do a year before they come to the College of Podiatric Medicine in one of those areas and then complete the degree as they go through podiatry school. The other option is with our College of Public Health, the MPH program, they can actually, we obviously offer courses in public health as part of our curriculum. Those courses count toward earning a master's in public health. So they can actually graduate as long as they've taken the courses and they enroll immediately afterwards. They can enroll and do their MPH while they're a resident during their first year
I
and
think that's awesome. That's
Wow, that's
awesome.
great.
Yeah. Good for
uh,
you. Good for
I think
you. That's
it's interesting because a lot of students come into podiatry school, and we've kind of noticed this. They have an interest in doing a dual degree or getting a
Mhm.
PhD along with their DPM degree. The problem is that first year they come in and they think, well, I'm going to do research, and then they realize that oh my God, I'm taking 25 science credit hours per semester, and I don't have time to do this. And so that's probably the enigma that I have with this is that we want to get them involved, but really our primary purpose that first year or year and a half is to make sure that they're concentrating on their preclinical basic science courses. We want them to be successful, and they can't be successful if they don't pass those courses.
Like what you're hearing? Go ahead and subscribe so you never miss an episode again. Now, let's continue to connect on today's topic.
Yeah, no, it's a good point. It
Makes sense. Yeah. Go ahead. I'm sorry, Adrian. This is
no, you brought up a good point. I mean, I've had a curiosity about that because I've had a lot more non-traditional students, really do reach out and they see the value of our profession. And that's been a question is, well, in my former life, I was, a radiology tech, and then I did, I got a master's in this as well. And so, should I pursue this? Or a lot of engineers, kind of migrate over as well. I've seen a number of them. So I guess from my perspective, it seems as though that they have a lot more world experience.
Right.
And so they make really good residents that way, I've noticed.
Interestingly enough, I think this year, our incoming class, the average was a 3-year gap. So these people,
Really?
70% of the students have had have had a gap year at least between graduating and going into podiatric medicine.
Mhm.
And I kind of identify with them because I graduated from pharmacy school. I practiced pharmacy for 3 years and then went back to podiatric medical school. So I kind
Yeah.
of understand exactly the thought process, but it's a huge number now. And we began to research it. Actually, they're finding in allopathic medicine the same thing. They have a large number of students who are applying after gap years.
so.
Interesting.
I think this is something that might be that shift that we need because with the healthcare delivery system, uh, student recruitment crisis, perhaps, and then student debt and student indebtedness. I believe solutions for anything need to come from within. I'm not a big believer that corporate America is going to solve how doctors take care of patients in a clinic because they've never done that. And so
Right.
I like the idea that the doctors themselves are getting parallel training, and then maybe they are the ones who can take charge of recalibrating the conversation around how the delivery of healthcare needs to go, right?
All right.
Because it seems like the only entity that's ever really done that successfully is maybe dentists. They seem to have always sort of figured out a way to still control their own destiny as far as the economics and the business of medicine as well as patient care. I think I like what I'm hearing. People are getting some real life experience, and then your school is offering them those dual degrees. It gives them diversification of job opportunity, but also knowledge transfer. It's really that's I think that's very exciting to hear.
And I think those dual degrees can come in very handy because, again, as we look at the students, uh, kind of their goals now. When I was in school, probably Luke, when you were in school, the vast majority of students were looking to be in private practice. They were looking
Absolutely.
to come out and either start their own practice or join in a practice and somehow become a partner in that practice. Uh, Now it seems to have completely flipped itself, and the vast majority of students that I see coming out are wanting to work for either a hospital system, some sort of healthcare system. Very few of them uh, kind of have an eye toward entrepreneurship from a practice standpoint. So, we kind of have to adjust to that.
So, kind of piggybacking off of the direction we're going there, I do have a question about, student recruitment and kind of the, shortages with, just this whole kind of enigma with what's going on in student recruitment.
Right.
So what is your take on that and the profession itself?
Well, I think there are a few things as I've looked at this, and obviously I've pondered this now over the past several years as we've
Sure.
kind of entered into this. I'll call it a cliff from the standpoint of that we're standing on the edge of it. And I think there are a number of things that are going on. Number one, I think a lot of people are not interested as much in spending the next 7 to 9 years of their life uh, pursuing medicine, whether it's medicine or podiatric medicine or osteopathic medicine. So I think that's one problem. Uh, Although applications to medical school are up, the number of medical school positions and osteopathic positions has increased significantly in the last 3 to 4 years. There have been a number of medical schools that have increased their incoming classes. Podiatry schools are obviously there have been a couple that have opened, uh, and osteopathic schools are kind of exploding everywhere at this point in time.
Mm,
Those are really competition that we have for students. And I think that's probably one of the major problems. I
mm,
don't think those would be as big a problem if we had uh, a, a better recognition in the public. And
mm,
my concern is public awareness is still not what it needs to be for podiatric medicine. And that's something that would benefit everybody in the profession, not just the colleges or the students, but the fact that I still think that we haven't done a very good job of letting the public know what we do and how well we do it.
mm.
That to me is my biggest concern, and that's going to take uh, concerted effort from everybody in order to get that word out.
100%. It's so true, and it's sort of really frustrating and disheartening, isn't it?
It
Because
is.
Really?
we have such an incredible profession, the breadth of the background, education, postgraduate training, right through the 443 model, possible fellowship, and then the need and the fact that the lower extremity mirrors systemic disease so well. It's just kind of a no-brainer. And then it's so you say to yourself, all right, well, it's such a no-brainer. How come it's not more celebrated in the sense of recognition, right?
And I think, it's always been, I'm sure, Luke, when you decided to do this, maybe not when you decided to do this, I can tell you when I decided to do this, there were a lot of people who said, you want to work with feet? You want to hit feet all day? That's what you want to do? And it was like, well, if you are open-minded about this, there are worse body parts to work with. And,
Yes.
you know, uh, it's it's not as bad as you might think. I mean, think about a dentist in somebody's mouth all day. To me, it's just I think people minimize what we do, and that's the problem. And they don't know the problems that exist. And the way it's interesting, the vast majority of our students, when they come to us, when they've applied, they've had an experience with a podiatrist.
Mhm.
That's how they know about podiatric medicine. It's not from advisors, although sometimes it's from an advisor, but the vast majority when we interview them, they say, "Hey, look, I was a high school athlete, and I sprained my ankle, and I saw a podiatrist, and they got me back, you know, to competing." And those people understand what we do because they've lived it. The problem is when an advisor says, "Well, did you ever consider podiatric medicine?" Most of the advisors don't even really know what we do, and that's a problem.
True.
So
Absolutely true.
to me, uh, we've probably all had our own experiences as podiatrists and how we found podiatry. But I
Mhm.
think very few of us, you know, you didn't see a podiatrist on TV doing anything, right? It was when I was growing up, it was Marcus Welby or whatever you wanted to be, Marcus Welby. Uh,
Mhm.
but the bottom line is, uh, we just haven't made that awareness as well known as we should. And dentistry did it a number of years ago when they had major campaigns to make sure that everyone was getting, annual or semi-annual dental checkups. Uh, so by the time kids are 6 years old, they know what a dentist does. They might want to do that.
It's a good point. It's interesting because I had my own personal experience where that's how, and I forgot about it actually until you just now brought that up because there were several paths, but I was on my way actually going to DO school. And one of the DOs that I was shadowing, her husband actually was a podiatrist.
Yeah.
And I spent time with him just very briefly, and I've never seen anyone enjoy their profession more than any other, and that's what changed my mind.
And it's interesting you say that because I think that from an enjoyment part of practice, I think it's hard to believe because we see there are people writing negative things all the time.
Mhm.
But I think the vast majority of podiatrists are pretty happy about what they're doing, their
Absolutely.
lifestyle. And
Absolutely.
I think that we need to make sure that that's the word that gets out. And our best recruiters are other podiatrists when it comes down to it. People who are in practice. And if I could encourage anything, it's all the folks who are in practice. If you see somebody who is college age or high school age, ask if they want to shadow. Open your office up and let them come visit you because just like you experiencing that one experience or two experiences and shadowing somebody, that's what got you interested. And you thought you knew what you wanted to do,
Mhm.
but then you realized that there was another path.
You're
I
you're a
think,
bit of a go ahead, Luke.
I was just going to say, y- a favorite line of mine is that the world's a mirror, and what we see in the world is what the world sees in us. And I believe that can be for professional identity, but also, let's take this line of conversation. I believe we have to beat the drum harder as a profession about mobility and function. When
Absolutely.
you have to say to yourself, well, what would I not want to have myself? And someone's not going to really say, well, I don't think I want atherosclerosis. No, I mean, they're not going to say, well, I don't think I want to be on dialysis. They're going to be like, I want to be able to get up and go, right? I want
Right.
to be able to,
I don't want to be in a wheelchair.
right. It's about, and so I used to tell patients, I'd say, when your feet go, you're done. And
Yep.
they'd be, huh?
Mhm.
And I even made up things like foot failure. I'd say, well, we've heard of heart failure, right? I'd say, well, you've got right now about 25% of foot failure. So we need to get you back down to, like under 10% of foot failure, like your foot ejection fraction, or whatever you want to call it. Make up your own analogy.
But you're
But
right, Luke. That's
it's about
exactly right.
mobility. It's about mobility and functions.
Yeah.
And that's what we have to sell because that's what it's all about. Who doesn't want to be out there moving?
Yeah. People don't appreciate it until it's them, right?
Exactly.
Until it's them and they can't get around. Uh,
Exactly. Exactly.
but I think that's what people see when they shadow a podiatrist or when a
Bingo.
potential
Bingo.
It is.
sees a podiatrist, they see what happens to their patients and they see how happy the vast majority of their patients are that are coming through the office.
Mm.
You know, uh, I think that that's the most important thing. And I think most students will tell you, they think, well, I spent time with this podiatrist and their patients they were satisfied, they were happy, and they were able to do things they wanted to do.
Yeah.
If before they saw him, they couldn't do that.
Yeah.
Yeah. They solve their problem.
Yeah.
We solve people's problems.
Yeah. I mean, I hate to say it, it's not in some ways, you were talking about atherosclerosis. Well, you know, you kind of solve that as long as you stay on your medication, right?
Right.
Once they come off their medication, it's headed back to ground zero. With us,
Exactly.
you fix something, usually you fixed it. It's good to go.
Well, if you want to get real medical about it, the more functional and mobile we keep them, they can build up collateralization of vessels
Right.
and so forth. And it's actually getting into the preventative, health, health maintenance
Absolutely.
than health rather than sick care, actually like truly health care.
We talk about fall prevention, balance. Those things are all important standpoint of foot health.
Yeah.
I saw
I
a great line the other day that contrasted lifespan versus health span. And I'd never really heard the word health span put together like that. And I said, you know what? That's really cool. I'm going to now plagiarize that for the next 30 to 40 years
Perfect.
because it is about health span. It's about how many years uh, of of chronic disease free quality days do you have?
Right.
Want to receive a monthly newsletter with topics from the Insured Connection? Head over to picagroup.com/Insured Connection and join our email list to have it delivered right to your inbox.
And where does that start? It starts with you getting out of bed in the morning and being like, man, I don't have, you know, heel pain on my first couple of steps out of bed
Right.
and everything else, right?
Yeah. I mean, if all of a sudden your lifestyle becomes sedentary, that
Right.
things start to spiral.
That's true. It is true. I will. You kind of jumped the gun a little bit, Dr. Boyk, and you read my mind when you were
Sorry.
talking about, what can. So my question was going to be, how can one individual physician, one individual podiatrist, actually affect this type of change? And I think I heard you saying that they take it upon themselves just to bring someone to their office, mentor, share a little bit about what they're doing.
Yeah,
Correct.
it's the easy thing to do, I think. You
Mm.
know, uh, there's a program now that Jeff Jansen has started with the AACPM, and it's the Feet on the Street program. Now, I don't know if you're familiar with that, but it's a program for recruiting from the colleges, and
Mhm.
that includes community podiatrists going out with people from the colleges in order to recruit at universities. So that's another way that
Oh, wow.
a single individual practitioner can help. And it's actually, the colleges, we will provide even slide decks for uh, podiatrists to go out and talk to pre-med groups to help recruit. And students want to see. I don't want to say that. I hate to say this. Students really don't want to see me. I hate to say it. They don't need to see some old guy come in and talk to them about how great podiatry is.
Well, Alan, I'm not sure, but it might have something to do with that typewriter to your right.
You like it?
Uh,
That's my wife's.
Probably no Stan can name that device.
You
Okay,
like
I
that?
I want
didn't
to.
even
I want
notice it.
I want to hear
It's,
the backstory on that before we. I won't have to talk about it now, but I want to know the history of that because you probably banged out some term papers on that. That's why they
I,
keep. Around.
I'd like to say that, but we were on vacation. My wife saw it in a antique shop,
Okay.
Saved.
but it's not much different than the one I probably did bang out some term papers on.
Was it my
Um,
was it my typewriter that gave away my age?
Yeah, exactly. But no, students who were recruiting, I really think they want to see a young podiatrist out there who's functioning and doing well.
They want to
mm.
see Adrian. They don't want to see you or me. They want to see you, Adrian.
Yeah, that's exactly right. They want to see Adrian. They don't want to see.
Get out there. Why do you stay at
I'll get
home?
back out there.
I never see you around.
But I think they need that relatability uh,
Mm.
in order to really kind of seal the deal for a lot of them when it comes down to it.
Yeah, I agree.
And I get it. You you
I
look
heard a
at someone
line.
and you want to be able to picture yourself in that position, and nobody wants to picture themselves as me. So
I
Oh, jeez.
I heard a line that I
uh,
believe is attributed to Ron Ray, and I think you probably know Ron.
I
I
know,
think,
Ron.
and Ron's such a great guy, great
Yep.
colleague, great podiatrist, great educator, and I believe that he said uh, that the solution to student recruitment walks through all of our offices every day, and it's about those young athletes, high school students, college students. We really, every podiatrist in the United States should really just have a QR code in every treatment room that scans and that scans to your school, the podiatric medical schools, and they should literally, when they're getting that high school lacrosse player or cheerleader back to practice after recovering from their sprained ankle, etc., they should say, "Hey, have you ever considered this as a career? Scan this code, and there's their information." And I tell you that um, would be phenomenal. I mean, I think that is so doable. It just needs to be done.
It's a simple approach. You're right. It could go right to the double A to their application
Mm.
page.
Exactly. Exactly. And we at Pike, I need to check with Becky where that's at, but we've tried to, I think help facilitate that. So maybe I'll circle back on that because, um, it's so many patients out there, coming through docs' offices all across every single day, right?
Right. And, I don't think anybody wants to see the profession, shrink
No,
because
No.
as we shrink, it makes us less relevant. And that's a problem from that standpoint. So,
absolutely, absolutely.
Well, Dr. Boyk, I will say I've enjoyed. I've enjoyed just listening to you. You have a very just humble posture, and I know you've done a lot more than even what you're saying for the profession. So grateful to have you on, and we look forward actually to having you back on maybe in the future if you're open to that.
absolutely. I really appreciate it. This was great. It was fun. Uh, you guys are great. And I appreciate the opportunity. Yeah. So, I look forward to working with you again.
Thank you, Alan. Adrian, I think we should have, invite him back with a student or one of his residents or one of the student leaders, like whoever's one of the student leaders in the school,
Mhm.
young leadership development, mentorship, someone, I think that would be great to continue conversations around the viability of the profession. Actually, that's not the word I wanted to use. The vitality of the profession,
I
around
think that's good.
the vitality of the profession, and how it belongs to the future colleagues. And they need to, guess what? They need to define it. They need to
Mhm.
define it themselves and accelerate into it because we're all have done everything that we have. We're continuing to be, the best chaperones possible. But when you're chaperoning, it's because it's like, hey, you got to start dancing on your own. We can only have
Exactly.
so long.
Exactly right. So,
Right.
I agree. I agree. Well said. Definitely. I think that's definitely a possibility.
perfect.
Well,
Thank
well,
you.
Dr. Boyk, yeah, and Luke, again, thank
Thank,
you just for,
thank you so much.
yeah, the input and just everything that you contribute on and off the screen.
And, and Adrian, thanks for all your hard work. I know you're working with our students
Oh, yes.
and,
Oh,
they come
Adrian's all
back.
over. She sleeps like 4 hours every other day.
Yeah. They
That's a
come
lot.
back.
That's a lot of
They come
sleep.
back. When they come back from that rotation, they're like, "Man, this is a great place." They
Oh,
love
that's
the place. So,
encouraging.
yeah.
That's encouraging. That's
Yep.
encouraging. Thank
So,
you.
Yes,
thank
that's
you.
awesome. Yeah.
Well, I'll say to our listeners, I know you enjoyed hearing Dr. Boyk and Dr. Cicchinelli talk, so I would say that please continue to tune in for the Insured Connection on any of the podcast platforms and just follow us. We give you tips and pearls and all kinds of tricks in the trade, for what we're doing and also hearing from the experts in the field. So with that said, please continue to follow, and we look to have you on our next episode.
And that's it for this week's episode. But let's continue connecting. If you're enjoying the Insured Connection, don't forget to leave a review on your streaming platform and subscribe now so you can connect with us each time we post a new episode. To stay connected with us throughout the week and to tell us topics we should discuss on future episodes, go to picagroup.com/insured connection.